Hello, my name is Harmeet Ghai, and I'm the PA student taking care of your case today. How are you doing today?
Feeling kind of crappy.
Oh, no, I'm so sorry to hear that. Can you verify your name and date of birth for me, please?
Yeah, Mallory Creed, 32498.
Oh, perfect. Okay, Mallory. And what's your gender?
Female?
Okay, and your pronouns? Okay,
Yeah,
perfect.
she,
And you okay if I call you Mallory?
Yeah.
Okay, Mallory. Oh, let's sit down here and see what's going on. Okay, so I heard that you're experiencing some sore throat and discomfort.
Yeah.
Oh no, I'm so sorry to hear that. But to better understand what's causing all these symptoms, we'd like to do a throat swab on you, and this will help us see what kind of infection it is, what kind of bacterial infection it is. It seems like it could be strep throat because that's going on right now a lot. And we'll find out what kind of pathogen is responsible once we do the strep throat, what kind of bacteria actually it is, so we can treat it accordingly, right?
Mm-hmm.
So if you're ready with that, we'll need your consent. You're okay for us to do that procedure?
I mean, what does it entail?
Oh yeah, of course. I'm glad you asked that. So let me explain you the procedure. It's gonna be like a throat swab. So what we're gonna do is, it's a very simple test. It would not hurt you. It would maximum, it'll give you a little tickle in the back of your throat. You might feel like coughing a little bit. And I'm gonna try to be quick and easy, make it that way for you. So we're gonna take the swab. I'm gonna put your tongue down with this tongue depressor, and I'm gonna put that tongue down, make you say ah, and I'm gonna take a quick swab of the tonsils back there, the back of your throat, and that will probably collect whatever bad stuff that there is causing all that infection in your mouth. So yeah, it'll take a few seconds. You have any other questions?
Yeah, so you said no pain, right?
No, it's just a little discomfort. You'll feel like a little tickle. Some people, yeah, you should be fine. It should be done in a few seconds, and it'll help us make a better decision and take care of you as well.
Okay.
Good.
How long does it take to get results and stuff?
So we are going to do a rapid in
Okay.
here, and then we're going to send one to the lab as well. That might take 2 days, but the rapid one will tell us if it's strep or not. So we can start you on antibiotic right away as soon as you get out of here.
Oh, okay.
Yeah. So, and yeah, we'll talk about all the medications and everything after that more, and make you understand the pathophysiology behind the disease and how you can take care of it and get better soon. Okay, that sounds fine?
Okay.
Great. Let's have you consent the procedure.
Yep. I can
Perfect. Okay. And then I will have someone collect all the stuff and start doing the procedure on you. So you see that we have the stuff over here. We have a tongue depressor. We do have a swab. We do have a collecting test tube. We do have eye protection. I will be wearing gloves, and we will do the procedure on her. Oops. Okay, that's great. Now that the throat swab is done, we'll send the sample to the lab, like I told you before, and if you test positive for strep throat, and if it's finalized, you're already on antibiotics, and if our office lets you know if it's viral, then we'll just basically take it light, be on a lot of fluids, do bed rest, take over-the-counter NSAIDs. And yeah, a lot of people have questions about over-the-counter NSAIDs. You're good with that?
What are NSAIDs again?
So over-the-counter, you can get your Tylenol. You can also get ibuprofen. That's
Okay.
yeah, all those
I've got
over-the-counter pain. Yes, that helps. That helps a lot of people. So and yeah, that's gonna help either ways, even if it's bacterial, and if you feel like you are having body pain, because sometimes bacteria can affect different ways. Okay. Just want to let you know that strep throat is contagious, so frequent hand washing is something that I bet you already do that. And avoid close contact with others, especially within the first 24 hours. I would say 48 just to make it safe since you start your antibiotics, okay? Rest, stay hydrated, over-the-counter medications to help with pain. If you have fever, like I said, acetaminophen or anything like that, it also helps with sore throat and pain in your throat. And I saw that you are a smoker, so I would avoid that because all these smoking and even if it's like if you're near like a secondhand smoke, that can irritate your throat, and obviously any irritant would further mess it up. So your symptoms should improve.
Okay.
I remember you had that question, how soon you were asking that, how soon will it affect? Okay, so the symptoms would improve 24 to 48 hours after you'll start seeing improvement after starting the antibiotics. And if symptoms worsen, like if you if you have difficulty breathing, swallowing, or any signs of abscess that you feel like you're having like a pus or something going on there, or one-sided swelling, if you see in the mirror or something, anything abnormal that you feel it is, and it's causing you way much pain that it shouldn't be that painful, you should go to the nearest ER right away. Okay? Any pain and swelling, if you're not able to eat food at all. I mean, obviously in the beginning you're gonna have some soups and everything that will help, or if you want ice cream and whatever liquid helps, that should be good. Okay, and would you like to know some side effect of the amoxicillin that we are writing for you?
Sure.
Okay, so they're very general side effects. Some people complain of GI upset, which is nausea, diarrhea. I'm not sure if you've taken it before and if you've experienced it, but I like to make sure that the patients know about it just in case they experience some things. A little bit diarrhea is okay with it. That's why we encourage you to drink more fluids and make sure electrolytes are good. I normally suggest my patients to get like that Ultima electrolyte. It comes in different flavors too, so you can keep drinking, increase your fluid intake, and it could also cause, amoxicillin can also cause like a mild rash or something. It's very rare, but if it does, we always tell you that if you feel anything like your tongue is getting swollen, that is an emergency. Go to an ER right away, okay?
Okay, yeah, that makes sense.
Yeah, and another thing that I see a lot of patients do is they only take like antibiotics, they feel better in 2 days and they stop it. I humbly request you to please take your full 10-day course of antibiotic, because the moment you leave it in between, guess what? You're making the bacteria resistant. And then the next time, amoxicillin is not going to work for you because now the bacteria knows how to grow, with it.
Yeah.
So complete that full course of antibiotic. Even if you feel better, you might start feeling better than day one or day 2, avoid sharing food, drinks, like I told you. Replace and sanitize like your toothbrush after the first 24 hours, okay? So your bed sheet, your everything, because that could have cough droplets and stuff like that, so you don't want all that. First 24 to 48 hours, once you're on that antibiotic, replace all those things. Toothbrush and all that, yeah. And avoid contact with people. Does that sound better?
Yeah, that makes sense. Thank you.
Less worried, of course.
Yeah.
You're welcome. And obviously, feel free to reach out if you have any questions. And I'll have I may give you a little infographic because that helps. Since I mentioned so many points, a lot of people feel overwhelmed with all that information. And I'll check in with you, and I'll send you a message on the app, the office app we have, about what exactly the results say. And I truly appreciate you coming over here and giving us an opportunity to take care of you, Mary. Well, you take care, okay?
Thank you.
Okay, you have a good one.
Okay, bye.
Bye.